Welcome to the webinar on Offer versus Serve at-risk after-school agencies operating the Child and Adult Care Food Program. Offer versus Serve, also known as OVS, is an optional type of meal service that can be used with at-risk after-school participants. So let's get started. As you can see on the screen, today we will be discussing Offer versus Serve and the CACFP. In order to follow along, have this USDA training worksheet available throughout the webinar. The top of the worksheet on page 1 explains what Offer versus Serve is and which participants can be served using this style of meal service. As mentioned, Offer versus Serve, or OVS, is an optional style of meal service that can be used to serve meals to at-risk after-school participants in the CACFP. Optional means that you do not have to use this type of meal service, but you can use it if you want. OVS can be used at breakfast, lunch, and supper only. Most agencies will use this option for supper only, and we will focus on supper for this webinar. It cannot be used at snack. It cannot be used in other CACFP settings, such as childcare settings and family daycare homes that do not serve at-risk after-school participants. OVS may benefit those sites that serve at-risk after-school participants by helping to reduce the food waste and give children more food choices. There are two terms we use often when we talk about OVS. The terms are food component and food items. These terms are listed in the first green box at the top of the worksheet. A food component is the name of a group of foods in a reimbursable meal. Examples of food components include milk, vegetables, fruits, grains, and meat alternates. These are all separate components, except for at breakfast only. Serving breakfast is not common occurrence with at-risk after school. If you have questions regarding breakfast, please contact your program specialist. Another term we use often when we talk about OVS is food item. A food item is part of a food component. For example, broccoli is a food item in the vegetables food component. On the second page of the worksheet, there are two additional tips about food items. As you can see, these two tips say that 1, all food items offered at supper must be different food items. For example, because apple slices and applesauce are two forms of apples, they are considered the same food item. Another example would be oranges and orange juice. Number 2, the full minimum serving size of a food item must be taken in order for it to count towards a reimbursable meal. So for example, the minimum serving size for vegetables for children ages 6 through 18 is a half a cup. So a participant must take at least a half a cup of vegetables for it to count toward that reimbursable meal. Now let's go back to the first page of the worksheet. On the left side of the sheet is information on how to use OVS at breakfast. Typically, at-risk after-school programs do not serve breakfast or lunch unless school is completely closed. Questions about serving breakfast and lunch at your at-risk program should definitely be directed to your program specialist. But on the right side is how to use the OVS to serve supper. At supper, you must offer these 5 components: milk, vegetables, fruits, grains, and meat alternates. As you can see, at supper, vegetables and fruits are separate food components. In OVS, you must offer at least one food item from each one of the 5 components at lunch and supper. Let's take a closer look at the example shown on page 1 of the worksheet. In this example, foods from all the components are offered: milk, carrots from the vegetable component, bananas from the fruit component, turkey from the meat alternates component, and a dinner roll from the grains component. You can offer more than one food in each component, but you must offer at least one food from each component. And as we mentioned before, you must offer enough of the food to meet the minimum serving size required for each of the components. A participant can choose foods from 3 or more components to make a reimbursable supper. So in this example, she chose milk from the milk component, carrots from the vegetable component, and turkey from the meat alternates component. The supper is reimbursable because she chose foods from at least 3 different food components. All right, let's try a practice question. Again, this site wants to use OVS as supper. You offer low-fat 1% milk, carrots, bananas, turkey, and dinner rolls. Karen is a participant who chooses everything that is offered, meaning she took milk, carrots, banana, turkey, and dinner rolls. She took the full minimum serving size of each item. Do you think Karen's supper is reimbursable? Great job. The answer is yes. Karen's supper is reimbursable. Again, when using OVS at supper in the CACFP, the participant must choose at least 3 of the 5 different food components in order to make a reimbursable supper and must take the minimum serving size of each. Karen chose items from all food components in the correct serving size, so her supper is reimbursable. All right, let's practice with one more question. Your at-risk after-school center uses OVS at supper. You offer fat-free skim milk, roasted turkey, roasted broccoli, steamed carrots, fruit salad, and whole wheat rolls. David is a participant who chooses the turkey, broccoli, and carrots. And they took the full minimum serving size of each item. Do you think David's supper is reimbursable? Nice work. The answer to this question is no. David's supper is not reimbursable. For OVS at lunch or supper and at-risk after-school sites, you are required to offer at least one food item from each of the 5 food components: the milk, meat alternates, vegetables, fruits, and grains. In this example, you offered fat-free skim milk for the milk component, roasted turkey from the meat alternate component, 2 food items from the vegetable component, roasted broccoli and steamed carrots, fruit salad from the fruit component, and whole wheat rolls from the grains component. The participant must choose at least 3 different food components in order to make a reimbursable supper and must take the minimum serving size of each. David took roasted broccoli, steamed carrots, and milk. Because the roasted broccoli and steamed carrots are both part of the vegetable component, David's supper only has 2 food components, the meat alternates and vegetables, and needs food from another component to make up a reimbursable supper. He should add the minimum serving amount of fruit salad, whole wheat rolls, and or milk to make that reimbursable supper. All right, let's take a look at the chart on the first page of the worksheet again. At OVS supper, the participant must choose food items from 3 or more food components. So in the example with David, you offered milk, turkey, broccoli, steamed carrots, fruit salad, and whole wheat rolls. David chose turkey, carrot, and broccoli. By doing so, he chose foods from the only 2 different food components, and he needs foods from 3 different food components for a reimbursable lunch or supper, such as turkey, carrots, and milk. On the second page of the worksheet, there are scenario-based questions, and you can use to check your understanding and knowledge. The first question pertains only to adult daycare, but the other 2 scenario-based questions are there for you to practice what we've learned today. The answer key is provided so you can check your answers. On behalf of the Office of School and Community Nutrition Programs, we thank you for taking this time to review this webinar on Offer versus Serve for agencies participating in the CACFP At-Risk After-School Program. If you have any questions about anything discussed in this webinar, please contact your program specialist. Thank you.